be part of my video and taking time out from your very busy schedule. I can see the number of patients lined up, and today morning, whole day, you must have had a very busy day with lots of medical engagements. But there are many questions that trouble me and trouble laymen like me regarding treatments, when to seek treatment, when to ignore it, because for every small little thing you can't run to a doctor. And you can also, sometimes we take our own little medicines which we make in our own home. We turn our kitchen into a pharmacy. And then suppose I'm having a cough. These days my throat is very sensitive, and for every small little thing it gets irritated. And what I do is I carry these licorice sticks with me, and I like to chew them, and that soothes my throat. So, is that advisable? How long can I do this? Suppose the cough is an indication of a more serious disease, but I am suppressing it like this. Is that advisable? Is there a risk to it? Is that dangerous? What would you say?
Dr. P.P. Bose, MBBS, MD, DTCD, DNB, FISDA, FBPI. Dr. P.P. Bose is a renowned physician with super specializations in pulmonary, critical care and sleep disorder, and has advanced training from Australia, UK and Germany. He has a doctorate in internal medicine and respiratory diseases from Delhi University and Karnataka University. He is a senior consultant, National Heart Institute and Fortis, New Delhi. He has served in Safdarjung Hospital, VIMHANS and Orthonova Hospital, New Delhi, and a Scots Dr. P.P. Bose is a recipient of the Delhi Medical Association Excellence Award and Scroll of Honour from UCMS, Delhi University, for his meritorious services. He is Fellow, Indian Sleep Disorder Association, for his contribution to the growth of sleep disorder medicines in India. As a founder-president of SARS Foundation, he is involved in patient care, community outreach activities, procedures like bronchoscopy, lung function, sleep studies, while also being involved in rehab, home care, research and training, special clinics on asthma, COPD, lung fibrosis, obesity, sleep apnea, pneumonia, tuberculosis and HIV, and has an exclusive clinic on lifestyle and breathing techniques.
Thank you, Dr. Sudipta, for involving me in this kind of interactive sessions, and I think it's a huge job which you are doing. I think there's a lot of confusion which is going across the for patient at large because of this digital world, and people are using all sorts of stuff to to mask the symptoms. I tell you, as you rightly said, the liquorize people are using. There's nothing wrong in using liquorize when you have a little cough or a little scratchy throat, or maybe which happens in a change of season. But remember, anything which is there, which is recurrent, repetitive, and it is happening for some good period of time, that means we are talking with this an indication of some disease. So when there is an indication of disease in the form of, like, for example, I being a respiratory specialist, if somebody comes with a chronic cough for more than 4 weeks, and it's a productive cough, and it affects your nighttime, sleep and also giving a little breathlessness and all that. The recorize is definitely is not the answer. Then he has to go to the right specialist, and you go to the root cause. And that is, people sometimes get confused, and a lot of misinformation which is coming in the society. And in that process, what happened? By the time the people come to our level, at the super specialty level, things get delayed and complications sets in.
Yeah.
So,
but sometimes, do you think these these home remedies, can also be very dangerous? Like I remember reading newspaper reports, it keeps coming, occurring, and then we forget about it, and then again it happens to somebody, and then again it is there in the newspapers, in the news, that when you are using these kinds of concoctions, like say you are taking gourd juice or bitter gourd juice or something, then your kidneys become toxic, your liver becomes toxic, and you could actually die of toxicity.
Yeah, this is quite alarming, and I keep hearing about these things, and people, especially this is the decade of people have a huge longevity now, and as I said, this is the decade of chronicity of diseases, and when you have a chronic disease, then people tend to pick up all those things, but unknowingly, or if you keep on consuming these things without knowing what can go wrong, you can accumulate certain kind of toxins, which in toxins go the wrong way. It can affect your organs, and one should be rightly informed, because just simply by somebody say this can work, one should not follow the rules, and and they should take the right information. They should review that product, and there are references that are available. One can read about it, and the most important thing is that anything which you take for a long period of time, okay, maybe 1 or 2 days you're taking, okay, you can try it and see. But when you're taking it as a medication over the period of years, because ultimately what is the definition of a medicine? Anything which is in certain doses, and every dose has its side effects, adverse effects. So you have to follow that rules, because if you keep on taking without knowing what exactly, whether it's a drug, in really playing the role of a drug or a toxic, it can really complicate the whole system.
I would like to ask you this question, because you are a chest specialist, respiratory diseases, and specializing in managing cure. Of course, I don't know how far asthma is curable, but in its management, since you are a specialist, super specialist in this, you will remember that there used to be this fish therapy somewhere in Hyderabad where they were doing this, and there were special trains that were being run to take people there, and they had that secret, some family secret medicine which they would put inside a small little fish and then make you swallow.
Can you imagine? And who used to be blamed? You see, even the front newspaper, the front cover used to cover, and there used to be special train. So that's why the political system, our print media, they have to be educated. I think the charity begins, and we have to educate everybody. Look, you have to follow, and this is happening in this part of the world, because we have all kinds of medications on alternative, or what you call those random medications which are available. People are following it. The reason being that everybody thinks that if this is not a curable disease, and somebody says I can cure it, it's something like faith healing, or taking the advantage of situation. I don't know, but one has to understand any chronic disease. Also, you can revert the chronic disease if you follow a structured protocol, if you follow the good lifestyles, if you follow the right thing. But again, the fish therapy, as you rightly said, this is really, there used to be a long waiting for these people, and there used to be one particular day, what you call the Puranmasi, or those something like this, and they used to put this, and they used to use a lot of steroid, what I heard, and a lot of and now definitely the government now has banned it. Good things have happened, but these kind of things are happening for every kind of chronic diseases. We are getting people.
See, look at this poster that I have photographed.
Really
Now this says that if you make a hole in your you come here and they will puncture a hole in your ears, and that will cure you of asthma.
They are taking the advantage of the situation. I tell you, 1 or 2 people may be getting you can say relief. The reason being, asthma is psychosomatic. I tell you, asthma has lot of emotional component. The asthma is basically sympathetic disease. So when somebody is giving you a disease and your sympathetic activity comes down, you become parasympathetic. You feel, okay, something has been done. It will go once for all, and it is a kind of faith healing. So it's basically you start believing yourself that yes, it's working.
It is working.
It's working. It's psychosomatic, what you call. It's at the cognitive level, but this is not the real disease treatment. One has to follow the right rules, and I've seen the damages have taken. We have lost people and youngsters, because asthma starts very early. The childhood asthma is a big problem, and if you don't follow the structured program, they'll end up into a lot of chronic diseases, and eventually they lose their lung, and they go into respiratory failure, and finally land up into ventilation. So these are the things should not be encouraged. And one of the things what the government should do it, putting up posters for the public, majority of people,
what I'm showing with such a big,
most of the people are ignorant. They are simple people, they're poor people, they don't know where to go. They see something which is coming up, and we have, and if you see what I could see, this is on the temple complex, and people there for a lot of faith. The temple has a lot of faith factor. So if you go to a temple and see this kind of, I think the temple association should be approached, not to propagate this kind of information, because this will give a negative impact to the whole society, and that too in the heart of South Delhi. This kind of things which are coming, nobody's protesting, and I'm sure in their whole management company they must be educated, and people will be there, and they must be noticing. They must be ignoring it. Society, we need to protest against it, and we have to tell people, at least through WhatsApp and other through digital, that don't get carried away with loose information. They should always check up with the right information. I'm not saying the digital world is wrong. There are right things also. They can go to the right links. There are right sites where they will tell you what is right and wrong. And this loose campaign, one should not get carried away.
But allopathic and allopathic, which we say is the mainstream medical system, and the other alternative systems that we have, When will you say that this medicine is allopathic, which has been approved by the Medical Council of India and internationally it is approved? And what is our traditional medicines or some other kind systems? There are so many systems. What is the main difference?
Look, in colloquial sense, mainstream medicine we always call the allopathy, which is really scientific based and they are research based and everything. But if you really talk about the mainstream, there could be other than allopathy also could be mainstream. I think mainstream medicine should be all those which has got science behind it, which has got what you call ETC, evidence translated into practice, ETP we call it. There has to be an evidence which has translated into practice, and number three, and it has showed certain statistical significance as far as the certain therapeutic is concerned. So this may be relevant to allopathic science, this may be relevant to alternative medicine like
Yes, of
Ayurvedic
course.
or homeopathic.
Yes.
So there is nothing called this is bad or this is good. Any science can give you good
It's not a
results.
question of good or bad.
But what happens, what is people are going into? People are using this concoction of everything, because I've seen that, in primary level also, a lot of people who are from alternative stream of medicine, they're practicing allopathy, and a lot of people, there's a lot of mixed bag of
Yes,
practice which
yes.
is happening, and that's why the patients who are normally reaching the primary physician, they get misguided, and a lot of things have been offered to them, and in that process, what happens when you club different specialities, like for example, you club homeopathy and Ayurvedic, what you call the alternative, and allopathy, they create different kind of chemical equations, because everything is a different science. Because homeopathy works on the principle of aggravating the process and settling it, and allopathic science works on the principle of taking care of the root cause. So if you club these two sciences, then probably you get all those different kind of mixed reactions. So one has to. That's why I say that we need to inform people. Stick to one speciality, number one. Don't mix the specialities, and number two, always go by the speciality which has got some research base, which has got some scientific evidence, and which the literature, the scholarly articles quoted.
No, but see, my problem is that suppose somebody tells me that you have, say I see these, I see so many messages on WhatsApp which says that for cancer a cure has been found, and what you do is you boil this vegetable or that one and then keep it.
I just
strain
answer
it,
this.
and
Look,
then you have it kills, or lemon, maybe lemon.
this is what
you
is
have
happening,
lemon
because
juice.
I'm telling you why this is happening, because everybody is becoming an expert these days, because
Yes.
we have got this rectangle in hand, everybody starts putting their own messages, they think this,
Absolutely.
and if you have seen in the dengue time, people have all kinds of things,
Yes,
people are
yeah,
using
yes,
it
yes.
to improve the platelet.
Correct.
So, I'm not saying these vegetables or whatever the herbs or medicinal plants, which is wrong, because I also strong proponent, because we has to be research based. These wrong informations that you take only this will take care of this, which is wrong. This can work as an adjuvant.
Okay.
This can work as an adjuvant. One has to understand, whenever you handle a disease process, one has to go to the scientific base, the scientific linkage, it has to be disease specific, and this can play as an adjuvant, probably as an additional factor, which probably, and of course, you have to really check it up. It should not affect the therapeutic significance of the drugs we are using it. But saying something like that, this vegetables or these juice can take care of your some rare
Yes.
platelet dysfunction, this is absolutely wrong, nonsense, and this should not be propagated.
I see. The common perception is, even educated people believe this. Firstly, that this mainstream, or what you say is allopathic medicine, is expensive, and secondly, it has lots of side effects. Whereas these other alternate methods, or this what we are doing, or people think, what is the harm? If I do this, what is the
No,
harm?
I will just say, we have alternative medicine like Ayurvedic and homeopathy. I have full respect and full faith on this, but only thing what I have to understand, many times what happens in other science, people don't talk about the side effects, because not enough of research has been done. Modern research has not been done. So I'll tell you a simple thing. In homeopathic sciences, sugar ball is used. Reason being, because the toxic drop is so bitter to taste. To soothe it, you take it in a sugar ball. The people think it's very sweet and less. No, actually it's a very high dose.
Okay.
To soothe it, to make it palatable, you use the sugar ball, because it gets absorbed. So every medicine has a side effect. You have to understand. Some probably they are not done enough of researching. They don't quote, but they say it's not research. It's impossible. Anything which you're consuming for a long period of time, there will be has side effects, but the side effects can be reduced. Like, let's not say that it will be wrong in saying that allopathic is bad and other sense is good. No, all the medications may have side effects. You have to monitor them very well, and you have to use the right routes to bring down the side effects. As I mentioned, in chronic respiratory diseases, we have inhalers. Similarly, in diabetics, we have the insulins, which can reduce it. You can tailor it, and also through a good lifestyle, also you can reduce the number of drugs. And of course, I will say wrong when the doctors start giving you for other interests a lot of supplements and vitamins, and I think most of the food is complete. You don't need anything. One has to go specific as far as disease specific is concerned. So that is all are manageable, and if you have a very incurable or a very chronic serious disease, yes, there may be side effect, but we have to monitor it, and that is the whole science about.
But what worries me is, that we think that we can make a pharmacy in our own kitchen and boil this or boil that, and then, there is this WhatsApp message I had sent you today in the morning that there is somebody sitting whose name I could not even find Google search and find that there's a genuine person like this. That this person sitting in the army hospital in China says that if you boil what was it, lemon or something, and then bitter gourd or something, and then cancer can get cured.
This is absolutely wrong. Look, I tell you one thing. In the place which we are staying in our beautiful neighborhood, Siapagan, we are coming up with a journal where I wrote, I am. I'm going to just go through my article where I said, yes, the indigenous herbs are useful. You can bring down the chemical hazards in the family by using alternatives, like you can use the beneficial of chilies, lemons, and white sodas. They're beneficial for cleansing and other purpose.
Right.
For as far as consumption is concerned, you have to be very selective in using it. But somebody claiming for fame that this can help people and without any research base, I think you should not follow any kind of medication which is not research based, which is not cohort, which has not been subject to some random cohort study, and which scholarly study doesn't advocate. As something like in the form of as a nutritional supplement, if somebody is recommending you, okay, we understand that there are cereal, there are protein, there are vitamins, there are minerals. Based on that, there are certain foods and they have certain nutrients which you can use as a certain nutrient, not as a medication.
Not as a medication.
It can be as a nutrient. Like for example, like jowar, bajra, and ragi, which are the millets. Millets have a very high level of nutrients,
right.
Because it is rich in calcium, which is and one can use the millets to supplement your system for for extra calcium, which the society has a lot of low calcium in the society. Similarly, a lot of good things are available. Like for example, like this can play a role as a nutrient, not as a medication. So don't confuse as a nutrient vis-a-vis a medicine. Medicine means it has to be disease specific, it has a side effect, it has to be monitored, it has to be research based, it should have relevance in medical science. So people try to confuse between nutrient and a medication. Both are two different things.
But what troubles me is that that some things may not be a nutrient as also.
Yeah.
For instance, this goat juice. Now, if you are having it raw, now the human body is not made to
People
digest.
get carried away. That's why
That's for cows can do that, goats can do that, but our body.
Even you won't believe. I'm not saying in Patanjali people are consuming what you call the gomutra. Gomutra is a huge consumption in our India because they say I say the baby cow may have certain advantages. But if you're saying that consumption of gomutra can cure tuberculosis or some kind of chronic disease, this is wrong. You can find it, and people also not making the right way. So these are the wrong communication. I think the drug control of India, their structure body, the regulatory system also should put a check on these people claiming this kind of things which can cure the disease, and this is not good. As you rightly say, that many times they are not nutrient, they are using for the sake of consuming, and somebody says it works, because when you make a juice of some raw things, you can get a lot of other toxins which can be equally damaging, like it can create a huge negative impact.
The human body is not capable of digesting it raw. We have to cook these vegetables. Can we just consume it raw? We cannot, because it has these plants.
I'm not saying sometimes raw things could be equally good, but only thing you should know what exactly you're taking the raw. You can have a carrot, you can munch a carrot, that is different. Something a carrot, you can have a carrot, you can have a tomato which is rich in lycopene or beta carotene. But having some specific juice for for reason not known, that doesn't make any sense. It should be literature based, it should be evidence based. That is what we are talking about this, and that is very important to and as I said, that one should not confuse things between from the disease specific versus the casual specific. For casually people are using it and using people for disease specific, that can really complicate the disease, because by doing this people are following it, and you never know that one or two persons can get benefited not because of the substance, because otherwise also because maybe he's taking the other medications also, or maybe the disease is self-limiting. So people get carried away in that process, it gets rampant, and you get all those complications within the society, and that is what we are recognizing. And many of the things, as you rightly said, they are man-made. They are huge, detrimental
But
to the society.
one last question. You said many times that it should be research based and it should be referenced in a journal and it should be a scholarly thing. So there is, what I understand is that for a drug to be actually marketed, to get a registered trademark or a license, it is a very stringent process. It is not that you just think that because this has cured my friend and my...
It has to be a stringent
somebody,
process,
so
because after all it's for the life, it is your biological system. People have worked years and scientists have worked years to give something, and that is the mankind all about it. How can be so casual giving that this is work? This is a whole process has to be followed. That is how the drug is all about. That's why drugs becomes a medicine when all those rules are followed, and this is a huge process. And if you see the different stages of trials, if you read, because I am involved in a lot of trial programs, there's an animal experience that happen, then they see what is that. And normally mice experiments happen before we launch a drug like cancer drugs. What will happen? What will be the side effect? It affects on the longevity, morbidity, and everything. And this is all, it's a process. There are people who have been working, and that's why the patents is a big area of work, and that is how the science should be.
Thank you so much.
Thank you, Ashrita, for allowing me to speak on it, and I think my best wishes to you. And this is a great job you're doing, and I think if we can communicate to people and connect more and more people by changing
I'm
them
sure
and influencing and motivating them, and I think
sure.
it will go a long way. And I think the little which you are doing, I think it will create a huge impact in the society. Thank you so much.
I'm sure that your talk is going to give a new direction to many of my viewers. Thank you so much.
Thank you.
Thank you.